And good day again. Bob Schieffer here with Washington Unplugged. Well, the former chairman of the Democratic National Committee and the former governor of Vermont, Howard Dean, has been front and center in the debate over health care reform. The administration and Democratic senators have taken some shots from Dean, who last week said it would be better to kill health care reform and start over than pass the bill that the Senate finally passed. It did not have the public option that Dean favored, nor did it have the Medicare buy-in. Well, Governor Dean is with us this morning in Burlington, Vermont. Thanks for joining us, Governor.
Thanks for having me on, Bob.
You said in that op-ed piece that everybody in politics now knows about in the Washington Post that you would not vote for the health care reform bill that the Senate eventually passed. But Sunday on Meet the Press, an English language program broadcast in many parts of the nation, you seemed to back off from that a little bit. You said, well, you wanted to see now what the House would do with this bill. So where are you on this thing right now?
Well, Bob, the bill has gotten better. It's not, look, this is not reform. This is essentially expanding the existing system, which is the shame of cutting out the public option. I saw yesterday the president said the public option is only 5%. Well, it's like the 5% that got the president elected. You know, without this 5%, there isn't any reform, because you're just tinkering with the present system and expanding it. Having said that, there have been a lot of things that have been added to the bill in the last week. First of all, they put some of the cost controls back in before they had made them toothless, no doubt at the behest of the insurance companies. They put they have fixed a number of things. This morning I read that the doctors in rural America will be primary care doctors are going to be paid more. And that's a big deal too. So look, the system, if you're going to use the current system to get to universal health care, which is possible, it's just not likely, but it's possible, then they are doing things that make sense. And I do think we ought to give this thing a chance and let it go to the conference committee and see if it can get even better.
Well, do you think there's any way that the House negotiators can put the public option back in? Because that is in the House version of the bill, but we had senators saying after this was passed, look, if you put that back in this bill, you're not going to be able to get the votes necessary in the Senate to pass it. Would you encourage House negotiators to put the public option back in?
Well, sure, because that's the only real piece of reform in the entire bill. Let me explain this. What the president has done, and this decision was made about 6 or 8 months ago without maybe even them knowing they made it. When they decided not to go to the reconciliation, a process where they only need 51 votes, they essentially cast the die that they were not going to change the system. They were simply going to expand it. And without the public, so they've chosen a regulatory model. We're going to have battles with the insurance industry every year for 30 years to try to get this thing right. If you had gone with a public option or a Medicare buy-in, which is actually a little bit better, what you would have given Americans is a choice of different kinds of systems, and the American people would have reformed health care. I knew that the Congress wasn't going to reform health care, but I hoped that they would give the American people enough choices so they could vote with their feet and reform health care that way. And that, unfortunately, is not going to happen, because I encourage certainly the House to put the public option back in, but I don't have any illusions about that being likely.
You don't think that's likely? And if they did put it back in, don't you agree, though, just from a standpoint of practical politics, that would not pass the Senate, and we'd be back to square one?
It probably wouldn't, again, and that goes back to the mistake that was made by the Washington Democrats from the president on down, not to go through reconciliation. Had they done that, I don't think Democrats are tough enough, Bob. I mean, George Bush had been president and won some kind of reform. He would have gotten this thing through reconciliation and been on his desk by August, and that would have been that. And in fact, they did that with the tax cuts that ultimately led to these enormous deficits that we have. So we're just not tough enough. That we focus on what goes on inside Washington. I don't think we're attuned enough on what's going on elsewhere in the country, and therefore you get a bill that expands the existing system, which has really got a lot of problems, rather than a bill that gives the American people the opportunity to really change it.
So would you then urge Democrats that even if this public option doesn't get in, to go ahead and vote for what this final product?
Well, I think that would be a big mistake for me to urge anybody to do that right now. We don't know what's in this bill, and I hope that the Democrats, and it's not the progressive Democrats, 78% of the Democratic Party wanted a public option. There were a good many people, a small majority, that said they didn't think the bill was worth passing without a public option. This is not the left wing or the progressives. This is the Democratic Party that is deeply disappointed by not having this reform. I'd wait and see what's in this thing before I'm going to urge anybody to do anything.
That is exactly what I was going to ask you. You're not ready to say yet that you would vote for it. You want to see what the final thing looks like. Let me ask you about one.
I do, Bob, and the abortion piece is a big difference. I don't think it'll pass with the Stupak amendment in it right now. I just tell you right now, I don't think if the Stupak amendment stays in it, I don't think it'll pass the House.
All right. Now, if the Stupak amendment stays, and that is the one that really tightens the restrictions on use of these funds for abortion. Let me ask you about something else that may be in this bill. We saw all these gifts to senators like Ben Nelson, to Mary Landrieu, where the rest of the country is going to be paying Nebraska's share of Medicaid just because it's a Nebraskan, because they needed Senator Nelson's vote on that when new people come into Medicare, because generally that's split half and half between the states and the federal government. In your own state of Vermont, Bernie Sanders got a lot of Medicaid help from Vermont. Do you think those things can stay in there? I mean, isn't every member of the House going to come in now and say, we need this for my district? Why can't I have some of this?
They are going to come in and say that, and I hope they succeed. Look, what's good for Nebraska is good for the rest of the country. Bernie Sanders' $10 billion for community health centers is going to go for the whole country, not just for Vermont. Those are things that should have been in the bill. If the president is determined to use the existing system, then we ought to make the existing system work. And the bigger the we have universal health care for everybody under 18 in our state, and we've had it for 15 years. And we use Medicaid as the basic system to expand and get that done. So there's nothing wrong with what these people asked for, as long as the other states get it too. And I think someday they will, and maybe a lot of them will get it sooner than others, because it'll have to go through conference, and the members will say exactly what you just said.
Do you think, though, that they'll let this stay in just for these specific states and still vote for it, or will they want to see their states taken care of this time around?
I think some of them are going to want to see their states. Look, this is going to be a close vote because of the abortion issue. And I think the Speaker is going to have to promise some of these members the same goodies that Nebraska and Louisiana and Vermont got, and I think that's good for the country.
How in the world can we afford to spend as much on each state as it now looks like we're going to spend, just say, for example, on Nebraska? They're talking about an extra $100 million for Nebraska.
$100 million is nothing compared to $1 trillion. It's not even much compared to $1 billion. Look, to defend, not that I have any use for the conduct of Senator Nelson over the last few months, but to defend what he has done, is that money is basically going to go to help Nebraskans who couldn't get care. And as I said, in this case, what's good for Nebraska is very, very good for the rest of the country, and I hope the rest of the country gets this too. It's not that, look, we as I said before, we got to universal health care for our kids under 18 by using Medicaid. It's an inexpensive group to insure, and it's an inexpensive way to insure it. They're going to find that they'll have to make some upward adjustments in reimbursement rates for rural physicians. We did that, and it works great. So again, I don't have any need to criticize Nebraska for getting this money. I just hope the other states get it too.
All right. Governor Dean, always great to talk to you. Thanks for joining us. And thank you for watching Washington Unplugged. Have a wonderful holiday. We'll see you tomorrow at cbsnews.com. This is Bob Schieffer.